St. Lucia's healthcare sector is confronted by a triple threat of respiratory illnesses. The Chief Medical Officer, Dr. Sharon Belma George, says St. Lucia is not going it alone in its effort to keep COVID-19 and its co-conspirators under control.
We as citizens, we also need to take personal responsibility for our health. We know how this is transmitted, and we also know that the most vulnerable groups are persons with chronic illnesses and the elderly. So in relation to increased sanitation, which is what we've asked the public to do, the hand washing, and we have a very strong recommendation for the elderly and persons with high risk or chronic illnesses, the use of the face mask to reduce the impact on them getting COVID-19 or any other respiratory illness at this time.
The recent upsurge in COVID-19 has resulted in deaths and increased hospitalization. This comes as St. Lucia prepares to host some major mass crowd events, cricket, carnival, jazz, among the other social activities, banking on the numbers for their success.
We have been working closely as a region because we are aware that there is an increased risk of infectious diseases, and we're not only speaking about respiratory diseases like COVID, but general infectious diseases entry into St. Lucia. So we have been meeting with our regional public health agencies to ensure plans on a number of levels are in place. Myself and other members of the Ministry of Health, we form part of the local organizing committee for the cricket coming up, and we also form part of the regional organization managing the public health impacts of activities at this time. So there are a number of things that we are putting in place. Increased testing capacity, increased surveillance at the ports. Our health facilities as well have to have the capacity to be able to manage diseases and illnesses that we have probably not managed before. So from last year, we have been working with the regional public health agencies, putting these measures in place to reduce impact and to give us the capacity to be able to detect in a timely manner the introduction of infectious diseases, which is a possibility with mass crowd events of this nature.
The Chief Medical Officer says St. Lucia's public healthcare sector has moved into a state of readiness, piggybacking on some of the tried and tested measures last time around.
At this point, we've had a history of the management of COVID-19, and we have integrated COVID-19 into our general health system. So what we advise persons, personal responsibility is extremely important. The Ministry of Health, we've taken on the role in terms of ensuring that our health facilities are prepared to manage increases in hospitalization. We have been meeting with the various sectors in relation to central procurement and equipment and supplies, preparing in relation to our ventilators, etc.
This is not unfamiliar territory for St. Lucia's healthcare sector, though the threat this time around involves not only a deadly variant of COVID-19, but also influenza A and B and respiratory syncytial illness. Stanley Lucian for the HCS News Force.